It is rare if I go a week without a patient crying in my office because of how devastating their condition has been to their life.
I love gardening, I love yoga, I love dancing, and I run around a lot. I have a lot of energy, and I couldn't do that.
It's amazing how many people live silently suffering from these conditions for years without seeking care or recognizing that there is an opportunity to have these problems addressed and fixed. Urogynecology is a subspecialty out of obstetrics and gynecology that focuses on care for female pelvic floor disorders. I think first and foremost, I have specialty training in care for pelvic floor disorders, both the conservative and surgical management of problems like incontinence and prolapse that a general gynecologist may not obtain in their general training. In my training, I had the opportunity to learn all of sort of the innovative approaches to managing the pelvic floor. So I've been trained in advanced laparoscopic and robotic approaches to prolapse, to manage incontinence and all the ways that we know how to manage it. I want my patients to know that I will listen and that I will work with them until we find a solution to their concerns.
Meeting Dr. Washington was just such a relief. I was embarrassed. I felt ashamed that there was something wrong with me. And she immediately is so reassuring. It just reassured me this is very common. And her office staff, Sharita, just you felt welcomed and that this was okay and they were going to take care of it.
Not only am I their provider, but that there are a host of other individuals that will be a part of their care team, from my office staff and nurse and medical assistant to the other providers in our institution, ensuring that our patients receive the highest care possible.
I can do all activities, and then looking back, I realized how many things, little by little, I had stopped doing.
Patients recovering and returning to the quality of life that they hope for is the most exciting part, I think, of my job. It's the reason why I do what I do, so that patients can live the lives that they want to have. If there was anything that I could tell women, it would be that there's a lot that we can do to either improve or resolve these problems.